Hi everyone, welcome to another episode of StudyMEDIC podcast. Today we'll be discussing about MRCPsych, the most sought after profession in the UK currently. For that, I have Dr. Sowmya,
Hi.
co-founder and chief mentor at StudyMEDIC, and myself, Mithun. Hi ma'am.
Hello, Mithun. How are you?
Yeah, I'm fine. So recently there was a report that says there is only one consultant psychiatrist per 12,565 population in the UK. So why is that? Because the need of a psychiatrist in the global scenario in itself is actually increasing. People are more aware about the mental health. Earlier they used to, there was a social stigma towards going to see a psychiatrist, but now due to the stress, the social anxiety, the pressure, the work-life balance, everything, the need of the hour is psychiatry. So why do you think that there is still a shortage of psychiatrists?
Probably because, the psychiatry itself, like, for example, when we were doing a post-graduation also, probably psychiatry we would never consider to pursue because very few of my friends wanted to do psychiatry back then. But probably we were more interested for doing other clinical subjects. But from then to now, there is a lot of difference because probably according to WHO, like one in eight people actually they undergo some sort of psychiatric, probably depression, anxiety. And if you see for the children now, ADHD, autism, everything has been increasing probably because of all these overuse of the technologies and nuclear families. Unlike before, you don't find the joint families, very rare. Okay, especially in the metros and the cities, it's a very nuclear families. So you do not have somebody to share your stress, and obviously the career changes and the layoffs. So there's a lot of things which is adding on to the things, and women are more career oriented now. So they go through a lot of challenges maintaining the families and social pressures, peer pressures. So over the time, I think we are, as human beings, we are becoming less adaptive to the stress. I think right now, psychiatry is the one branch where people are looking at with a lot of hope. For doctors, it has become, I think, a trending profession, I would say. Probably because mental health, as you mentioned, it wasn't like mental disease was not accepted as much as it is accepted now. Because if you see all the celebrities, when they talk about depression, people relate to them, right?
Yes.
So they see, okay, when Deepika Padukone came with the depression part of it, everybody was like, wow, this is so common. So that's how we are all like, you relate to the people, celebrities. So when you see that even they are not spared, so people have got a more of acceptance. And once this acceptance is happening, people are trying to get more help. So, but to balance that, we do not have as many psychiatrists as possible. So probably what I see now for in the younger doctors who are graduating post after MBBS, they are trying to pursue psychiatry, especially the MRC psychiatry, because it's not only helps them to choose this probably their dream specialty, but also of course the global recognition for that if they want to pursue in UK because they get the GMC registration, or it has got a lot of traction in the Middle East countries, and like globally it is more accredited, accepted. So that's the reason I think MRC psychiatry is actually booming now, and that is also one of the reasons why we thought of starting this branch as such to help students to clear these exams.
Yes. Coming back to MRC psychiatry as mentioned. So if I'm practicing in India after MD, there is a lot of peer learning activity among doctors in this Royal College examinations, and that is actually a community where you get to attend the seminars. Where that kind of cohesiveness is, I think, lacking in India in itself, right? After MD or super specialization, that unity of doctors, do you think that is actually lacking, or this system is a bit better in that sense?
No, actually, like we do have in India also, we do have a lot of organizations, like if you say IMAs. So each state has got their own organizations, each place has got their own organizations. So when they do the national seminars, the conferences, we tend to meet our colleagues, we discuss, but updating yourself is a totally different thing. Okay, so of course, after you finish your MD psychiatry, what next? So you will have to, teach the undergrads, you have to help your postgraduates, and probably you want to publish the paper. So that's where it was before. But right now, like if you do the MRC Psych, for example, probably you get a very different view of handling the people. Let us see, MRC psychiatry doesn't only stop at psychiatric illness, it also comes with addictions. Okay, if you see, the drug addiction is so much now. So, that is a very trending thing which could help the younger generation, the doctors to help the younger generations also. And when you see in UK, it is much more higher than what you see in any of the home countries. So, I think those challenges would help to deal for the psychiatrist better. So, probably it is a one step ahead of the MD psychiatry in couple of things. So I wouldn't say they are much better, but it helps you with your communication skills and dealing the newer diseases, and probably the getting the most recent updates of what is happening in the field. So it's always a good idea, whether you are an MD or an MBBS or you are pursuing a postgraduate, it's a good idea to take MRC Psych.
It's that you get updated, you get
yes,
regular
exactly.
update, you get the papers which are presented on an
exactly.
annual basis, and so on and so forth. So, what is the procedure? What is the eligibility for this MRC Psych?
See, MRC Psychiatry, for like any other Royal College programs, it has got 3 different parts: paper A, paper B, and clinical skill assessment, which is nothing like an OSCE. So, for the first 2 papers, it's a theory-based one. So, initially one will be basic sciences, which any post-MBBS graduate, if they focus and work around, they would be able to clear. Obviously, paper B is more inclined towards the specific psychiatric guidelines and things like that. And obviously, then clinical skill assessments, CASC is always about the OSCEs. So, there are a lot of queries about, okay, can I pursue this? Can I do this MRC Psych? To be very honest, MRC Psychiatry is something which you can easily pass if you get oriented towards yourself. And eligibility criteria, as you mentioned, paper A, paper B, they could take it without like post MBBS, but for the OSCEs, you need to have 30 months of experience, in which 1 year should be completely in psychiatry. So because that is something which they look at. And generally for the theory exams, they have got the single best answers and the extended matching questions. So if you work around for the concepts, I think it's an easier thing to do.
So I want to touch upon this MRC Psych in itself. So I think the OSCE has 16 stations instead of other. So what are those 16 stations? How is it different? Like, you don't have it's relating to mind, right? So how are the OSCEs conducted?
See, for Royal College programs, always it will be like the communication skills, the ethics and counseling stations. So you take, irrespective of the number of stations, you take any Royal College programs, you are always assessed on how safe a doctor you are, how good your clinical knowledge, how good your communication with the patient and the families, as well as communication with your colleagues, how it is going, and whether you are calling for help, because there are very few psychiatric emergencies which you need to be aware. And how do you handle a child, how do you handle an adult? So all these different domains are tested. And before jumping to the OSCEs, I think always Royal College programs are structured in such a way that you tend to first finish the basics, you get ready for the specific guidelines and the specific psychiatric conditions. Once you are completely get a hold of the knowledge, then you move towards the OSCEs. That's how it always works. And I think MRC Psych I have seen a lot of students taking this because they get a better job opportunities. And
they also get, I think, better work-life balance as well.
Of course, work-life balance, if they choose that, if they really want to be psychiatrists and they like that specialty, definitely yes. And also, I think the corporate setups, generally, even in home countries, the corporate setups and the semi-government setups, they always prefer somebody with membership exams, whoever has cleared. I think, and also for the patients. See, once you clear these exams, you are bound to be by default a good communicator, good listener. As a doctor, I think the empathy, sympathy and the compassion matters, goes a long way in helping the patients, especially with these patients and their families, which they go through a lot. So psychiatry doesn't mean only psychiatric illness. It's a huge branch actually. So because we are always controlled by our own thoughts. Only thing is it has to be balanced. Once it goes beyond that balance, that is when all these things happen. As I mentioned, there is a lot of element to this, like bipolar, schizophrenias, and these are the common things we know. There are a lot of other things like the addictions and how you're going to handle them, and probably the even related to the crime psychology. So there are a lot of different verticals to psychiatry itself. So I think you would get a hang of how to handle these situations, how to document, how to be legally safe. All these things are bonus points once you do any of Royal College membership for any time if you do. So I think that's an advantage.
I think one of the most the unrecognized thing in MRCPsych is that, as you mentioned, rightly mentioned, the opportunities beyond UK.
Yes.
Whether you go to the United States or whether you go to the Gulf region, the MRCPsych has its own value.
Correct.
If you are having just an MD and if you want to practice, MD is good, very good, not taking anything away. But if it's globally recognized more, especially Indian doctors, for them there is a huge demand. And if you have this additional qualification, I think that goes a long way.
It will add a point to your CV, and obviously, see, when you do a post-graduation itself, you are good.
Yes.
You are obviously good. But once you do, again, some additional to evidence-based guidelines, update yourself for the communication and all this, will be fantastic. So obviously, the hospitals would want to hire you to give a better pay, and obviously you will be able to handle the patients very well.
So if I'm an MBBS graduate, freshly out of internship, so I don't know what specialization to choose in. Okay. So what will be your advice for anyone thinking about psychiatry but not, I'm not sure. So what is your advice on them?
I think first of all, you have to be sure of the specialty you choose,
Yes.
because that's what you are going to leave with. Okay, so if you, for example, if I like OBG, then I have to pursue in that, because then my passion lies there, my hard work lies there. But unless if you are not sure of pursuing this, take some time, think about it, what are the pros and cons. But once you decide that you would want to do a psychiatry, if you want to do your national PG entrance exams, you can try. If you don't get, then you can probably, meanwhile also you can think of pursuing MRCP psychiatry, because as I mentioned, paper A, paper B doesn't need the experience, you can do it post MBBS. So probably if you think psychiatry is your passion, you must go ahead and start working towards it, because anyways, by the time you reach CASC, you need to have a work experience. By then you could, then with the evidence-based guidelines, once you start working in a psychiatry department, it adds a lot of value to your work as well.
I just want to have a personal question. Were you confused when taking the specialization back in your day?
No. I was very sure that this is what I wanted, because I know what I'm getting into. Because OBG is not a stream which is very easy. It needs a lot of time, dedication, hard work and sacrifices. But I think over the time, OBG has grown into a very casual and a calmer field than what it is to be. Because before, OBG was always full of pressure, tension, stress, because you deal with two lives. But I think over the time, we have learned an art of composing ourselves and managing, and of course, with the time and with the experience, you tend to become calmer and you know what to expect.
Okay. So we were quite deviating from the topic. So if I want to take MRCPsych from StudyMEDIC, why should I take?
Probably because, see, it's one platform where you get everything what you want to clear the exam. Okay, so, and also like probably a hand-holding thing, because once you start off paper A, you have to deal with the basics. Some of them could be very dry. You have to understand the concepts. It is never straight recall things in the membership exams. They always give a clinical based scenarios and the applied knowledge which you need to know. I think all sorts of audiovisual formats like summaries and the audios and the videos and the mentor holding and then, like the doubt clearing sessions, interactive discussions could help you to understand the concepts, and with lot of more questions on the way, you tend to revise, and so you're going to pass the exams by default. So I think like any other platforms, we do provide the academic resource, but probably once again the hand holding and helping them, motivating them, keeping them on the track is something which we genuinely do.
I think what separates is the flashcards, as well as the podcast. So flashcard is the thing that I like the most, and as well as the podcast. It's not about the live class. It's not only about the live class. If you miss that, you get the recording. But this podcast and the flashcards are really striking to me, because I am a visual learner.
Exactly. So there is a lot of different, as doctors, as any learner, depending upon your age, depending upon what has helped you. Some people want it to be very tech savvy. Some people want it to be only audio. Some of them want it to be video. Whatever it is, by the end of the day, whichever the form you use, you are supposed to be coming back and answering those questions correctly. That's the whole point. Okay, so to help any learner who comes to us with different formats. So that's the reason why we have kept it. And flashcards has always got a great attraction because it helps you to remember the factual ones and probably it gets imprinted. So I think that's why that's also one of the main elements for us as well.
Thank you, ma'am. So, if anyone who's interested in taking MRCpsych, do give us a thumbs up and get back to us. We'll surely help you. And if you have any doubts, get back to us. Thank you, ma'am. Thank you for your
Thank you
time.
so much.
Have a wonderful
Thank
day.
you.